Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Uganda's COVID-19 death statistics took a leap from triple-digit figures to now four-digit figures, currently at 2,104. The daily average death rate now stands at 25,
bringing the case fatality rate to 2.3%. Of these deaths, 1,127 were PCR confirmed, while another 746 are deaths confirmed clinically as probably due to COVID-19. And so our statistics will now be capturing the numbers including the probable deaths, and the numbers now stand at 1,873.
Since this 2nd July address on COVID-19 to the country, the case fatality rate has increased to 2.4%. Case fatality rate is the frequency in which cases of a certain disease, in this context COVID-19, die. And now, what was the need for revising our statistics upwards?
We want to know the impact of COVID-19 on our society and also its impact on our health systems. 2, we also want to plan better in future to ensure that we find out the major causes of death and we act on those areas to reduce deaths. And 3, for purposes of sensitizing the communities, because if deaths are occurring in the communities or in hospitals not confirmed, we need to pick them up and let the population know these are deaths due to COVID-19 and we need to protect ourselves. So deaths that are not confirmed will enable us to plan better in terms of diagnostics and ensure that there are other diagnostic systems that can quickly confirm for us whether these are deaths due to COVID.
From her earlier national address, Dr. Aceng said they finalized a clinical diagnostic criteria that will help to catch suspected COVID-19 deaths with no PCR or antigen rapid diagnostic test result,
or with a negative test result but with a clinical picture similar to COVID-19. Therefore, COVID-19 deaths will be reported in real time as PCR or antigen RDT confirmed or probable COVID-19 deaths.
But how will this be done?
In all our regional referral hospitals, we have set up what we call gene expert machines that are able to give PCR tests within 1 hour. So whoever comes in and is critical, and we cannot run around bringing the samples to Kampala, the samples are analyzed there and then. These gene expert machines have a capacity of 16 samples at once, and therefore the isolation facilities do not have to struggle. They can diagnose the patients and treat them accordingly. We are also working out a program of ensuring that as time moves on, every regional referral hospital has a CT scan to scan the chest and look at the clinical picture in the chest, or rather the radiographic picture, and tell whether it is COVID or not COVID.
However, some sources within the ministry say statistics are key for acquisition of vaccines, for a fact that low numbers mean a country may not be considered by the COVAX facility arrangement as priority over those with high figures.
Obviously, the more deaths you have, the more it shows you what kind of a system you are having. And in Uganda, I must really congratulate and appreciate the health workers. They've done a good job. The mortality is high, but the numbers have been relatively controlled. However, it is important that moving forward, all our population are vaccinated so that we don't have severe disease and death.
With about 20 days to the end of the 42-day lockdown, Dr. Aceng says they have registered some positives.
The lockdown is beginning to have impact, as we had predicted, that after about 3 weeks we'll be able to begin to see a dent. And shortly we'll be able to share with you some of the statistics, because the statistics have to be a whole of country statistics, not only Kampala. Our teams are working on these statistics. We are beginning to see small drops in numbers beginning to show. And it is good because then it shows that whatever we intended with the lockdown is actually taking root.
The lockdown, despite its social and economic impact, is meant to slow down the rate of infection, which has since fallen from over 21% about 3 weeks ago to 9.3% as of today. Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.